Hey, Dr. Lindsey here. I wanted to introduce this video. This is a 60-ish year old guy with very fine hair and class 6 or 7 hair loss, and this is a big project. And so I see a fair number of people like this, and it breaks in exactly 50-50 of guys that come in with this type of hair loss. A lot of them have seen some kind of crazy ad on the TV or seen another doctor who said, oh, they can take a little hair and sprinkle all over the head, and that is just not doable, particularly with fine hair. Because it'll look like a chia pet. It just won't be enough. And so what we do, and we do 5 or 6 of these guys per year, and it's always a 2-step process, and then typically they're, I won't say out of hair, but they don't have enough donor hair to make the reward of a third case worth doing anything. There's not enough hair to cover the rest of the crown, no matter how many times you come in. So step 1 is frame the face, and step 2 is somewhere between 6 months and several years later, we do the second case. So this guy came in and he knew exactly what he wanted. He saw a couple of examples of this and said, yep, frame my face and I'll come back in a couple of years and we'll do part 2. So he came in at 6 months, and I'd forgotten that he let me use his face. So you'll see his face in the 6-month video. And then when he came in last week at 2 years, I'd forgotten all about that. And so you don't see his face in the 2-year video. But when he comes back this spring for his second case, we'll do a full interview and put it up. But essentially, we took him from being a real bald guy to being a guy with very thin hair and a big bald crown. And so half of the guys that roll in here as an initial consultation say, man, if you can't cover the whole thing, I don't want any part of it. And that's fine. I can't cover the whole thing. This is what I can do. And half of the guys will roll in and say, yeah, that's what I want. I won't look like I'm completely bald anymore. And if you just watch TV, particularly the morning political shows, you'll see a bunch of guys who have done exactly this, and they look unremarkable, which is the goal. Not to make you look perfect, but to make you look unremarkable. And so on this fellow that has very fine hair, we did 2,500 grafts, and he grew in pretty quickly at 6 months. And now, of course, he looks better at 24 months or 23 months. And we know exactly where we're going to start the next case. We'll cut out his scar, and I hope we'll get about 1,800 grafts. Maybe we'll get 2,000, and we'll put 200 or 300 singles right at the front to bolster his part line, and the rest behind that. Take a look at the video, and I hope this helps. Dale, you're 6 months out from 2,500 grafts.
Yes.
And we did platelet-rich fibrin matrix injection on you, which up until recently I didn't know whether it really did anything or not. But now you're in a series of a bunch of guys with fairly fine hairs who are just growing faster than expected. I mean, this is 6 months.
I've got very thin hair. Had the procedure done back in January.
And you had a big problem. I mean, you've got a big head.
Yeah.
And you've got a very limited donor hair.
Yeah.
And so we picked framing your face, right?
Yep. I was for the most part bald.
Yeah. And that's a tough project. Yet, man, I think you look fantastic at 6 months, and it's only going to look better at 12 or 13 months. And then when we hit up again and do a second case.
Yep. Oh, you can see the other ones growing.
Yep. Oh, yeah. See?
You see the tiny ones there?
Yep. And so the second case will start right behind the first, and we'll get back to probably right there.
I'm very, very pleased with it. Couldn't be happier. Life-changing, really.
So
it is.
How much did I hurt you when we did this thing?
It was very, very minimal. You know, we just used the muscle relaxer or whatever we used.
The Valium.
Yeah.
And did you swell a lot afterwards?
I had some facial swelling, but it cleared up pretty quickly.
And were there any surprises in our 6 months together?
Oh, no. You've been very good. In fact, one of the things I really like about Dr. Lindsey is so responsive. I can email, call, and, you know, very, very few doctors are as responsive as he is. So.
All right, well, I certainly appreciate your input there, and I'll post this and send you a link.
Okay.
All right. Okay, so we did this fella 23 months ago, and going for him is that he's got salt and peppery hair. Going against him is he's got a very limited donor area. You know, we did I think 2,500 grafts on him. I thought we could get another 18 to 2,000 if we did down the road. And that scar turned out good, or pretty good, you know, above average. It's right there. And so if he chooses to, we'll come back and get him to do some stretching exercises for a few weeks, and then cut out the current scar and get 2,000 grafts plus or minus, and chin up towards the ceiling again, please. And we'll start right at the back, and we'll get probably right here. And this is a lost cause. There's just not enough hair. And then would you turn around? I will be careful not to get your face in this. All the way around towards me. And so on these fine-haired guys, as I probably mentioned to you a few years ago, and I'll beat into again, is that no matter how tight we pack them, you always need a few more at the front. So if we get a strip with 2,000 grafts out of you, I'll tell the cutters to cut them chunky, and we'll put the 2s and 3s back there, but we'll still get 300 singles, and I'll suggest we put them right on your part line, so that it just gives you more hair there, and this will be an easy case, and you won't have as much swelling. How do you think it looks?
I think it looks great.
Good. Yeah, I mean, you were a bald guy before,
Yeah,
and now if I saw you outside, you just look like a normal guy with thin hair.